this group of people that you have working with you to help raise money is the most organized, passionate group. No, I'm not. I'm Kirk Dilbek. I am the pleasure of being the chairperson of the Charitable Foundation. And this morning, as I was setting everything up and making the sauce and doing all that bit, it dawned on me that this is the 20th year. We just concluded the 20th year that I've been involved with this. The message is, consistently what we can try and do for you guys, because you guys are the ones really doing the hard work. And we so appreciate what you do.
Many of the individuals that have autism are not verbal at all. They might have some very rudimentary speech. They might learn a little bit of sign language. They might be able to point to a picture to say that they want more cookies. These days, they're able to use an iPad that might be able to speak for them and say, I would like to give mom a hug, or I want to go outside right now. And these very simple things that we take for granted. And with our funding through PFAR, we really like to provide these individuals with those things that they like to do. So we have the best books and the best toys and the best software and technology and games and things that they can get really excited about. And without this funding, we would not be able to have all those bells and whistles and technology that can really open new avenues for these individuals.
And we do one thing. We help people go to college and help people get jobs. And one of those people is Anthony Feliciano.
Well, I like working. I like my job. I like working with Ray. He's the best. And Chris, Tell me
what you do.
I do bracelets all the time. For like the hospitals.
I can't tell you how grateful I am. Charitable Soul lets the community know that our children have value. A lot of times people don't know how to react to developmentally disabled. They don't know that you talk to them just like you would talk to any other child. And what we want for our kids is what you all want for your kids, that they be treated with love and respect and patience and kindness.
So we are the oldest all-women's recovery treatment center in Pasadena and the third oldest in the country. We have residential treatment center. We have an outpatient center. We launched a day treatment center last year with the help of donations from PFAR and our other funders. Thank you. We also built a brand new detoxification center, and we have sober living facilities. You can literally enter residential treatment at one end of our property and transition to residential, and move your way across our campus to outpatient and sober living. So you move through our facility literally as you transition from, a place of absolute, despondency to hope and recovery.
We could not do the work that we do, not only without the funds that we get from PFAR and the Pasadena-Foothills Association of Realtors, but also because of dedicated individuals like these two gentlemen who are standing here.
As a realtor who's been involved in charity events and attending all of the great events that we work so hard to put on, and then see how the dollars are spent and see the impact that has been made from everyone's hard work and the actual dollars that come in. So I just want to thank you all for that as well.
Door of Hope is an amazing place. I just love it. I get to see lives transformed. And beyond that, we're also in the same business that you as realtors are. I don't know if you realize it, but you guys actually do the same thing we do. And I know that you get such joy when they sign that bottom line and you hand them the keys to their home. Well, we get to do the same thing for our families that were homeless, and to give them an opportunity to rebuild their life, and then to be able to sign that paper and to give them their keys is such a joy. Last year I was able to bring Carrie Ann, who's on staff with Door of Hope. She's been on staff for almost 3 years now, and she is actually a graduate of Door of Hope, went through our program as a single mom, and with 3 kids, came through our program, graduated, and now she's helping other homeless families rebuild their life. And actually she's our housing specialist, and she actually helps them negotiate with landlords and get the keys to their new apartments. Door of Hope in the last year was able to help 55 families. That is comprised of 55 families. There's 128 children in those 55 families that were homeless last year and are not homeless this year. And that's a joy to be able to share with you the results and the impact of our partnership, because that's what we do.
And I thought to myself, how sad that during this time in a person's life, she's all by herself. She was homeless, she was on the streets, and she knew that when that baby was born, that baby would be taken and put into protective custody. So I sat with Amy, and I never saw Amy again after that night, but Amy instilled within me a desire to do something. And what we do is we're a shelter program for pregnant women and their children here in Pasadena. So we take in women who are homeless, but specifically those that are 18 and older who are pregnant and may or may not have children already. And we provide a service for them of everything that they might need to really move forward in their lives. So it might be getting their GED, it might be classes in parenting, health education, life skills. We have a mentoring program, we do case management, and we do therapy. So we do all of that, but then in addition, we support all of the women who have come through our program. And actually this year, 2014, we are celebrating our 20th year.
Wow. Grandview Foundation is a substance abuse and alcohol treatment center. We do residential services, outpatient, and sober living for men, primarily 18 and up. We do some female services for outpatient as well. And so some of the things we've been able to do over the years with the help of PFAR and other folks is being able to provide like psychotherapy for folks who really would not have access to that, providing a physician who can come in and help with medication-assisted therapy, and continue to grow in our evidence-based programs and other programs that actually are quite effective at treating substance abuse, and really trying to treat the whole issue as a whole. Anyone who's been around that realizes that substance abuse comes with so many other issues along with it. And
last year, I shared with you that I was an alum of Can Do Kids, and my dream was to have this position. So my dream has been realized, and that's very, very exciting, for all of us. And so in this year, we have grown our music program. We've bought in more instruments, and we are doing guitar lessons, violin lessons, and we're also doing flute. And this is all free to the students who participate in our program. And that has been really amazing for all of our kids. We've also added a garden this year.
We work with former foster youth. A lot of us know that those kids who have been neglected or abused go into the foster care system at 18 years old. They kind of disappear. They disappear into our homeless populations, into the prisons. Well, we try to get them to reappear in colleges. We employ them. We help them get housing when they don't have the support from anybody else. So what we do at Journey House, we build a family similar to this one we have here. So this year we'll be attending 2 graduations, one out of Cal State LA with the Bachelor in Social Work, and the other one at University of Laverne with a bachelor's degree in communications. So those are 2 of our success stories for the year.
So I had polio, and riding helped me, and I believe that riding is good for anyone who wants to get out into the air or improve their skills and be helped by it. We love our horses. They've been donated by the Tournament of Roses. His name is Wrigley, and then we have 3 that have been donated by the Pasadena Community Foundation. Our accreditation is important to us because it tells everyone that we're a part of 700 other PATH centers in the country that provide services to the disabled using horses. We've had so many incredible stories because the movement of the horse is just like ours, up and down, side to side, back and forth. So consequently, if a child is in a wheelchair or if there's a child that has trouble walking, once you put them on the horse, then they're going to develop that movement, which is going to increase their balance and it's going to increase their confidence.
Each year, the Pasadena Senior Center provides services to over 10,000 seniors in Pasadena and the San Gabriel Valley area. At the center, we help seniors to develop their maximum capacity. this is the place where seniors develop lasting friendships. And as you may know, there's nothing worse than a lonely senior at home. And for many of our members, the Pasadena Senior Center is home away from home.
It's really rewarding to go to the PCDA and see the children through the therapy that they go through. A good example of this is a child named Adam, who, when he was 3 years old, he was being fed through a feeding tube. He did not have the ability to eat on his own. And through our feeding therapy that we have, over the years, they were able to help Adam where he could actually independently eat on his own. And he graduated last year at 12 years old from the feeding therapy program, and he can now eat with a spoon on his own. And that is really just, that makes our work so rewarding. And, I just want to thank PFAR for their support. We really appreciate it.
We give groceries. We help families not lose the roof over their head so that they aren't homeless. They can help get their lives back together. We serve the very, very low income. 77% of our families are below the national poverty level. Try go into a doorway and have to ask for the basics, to ask for food. That is really, really difficult and very humbling for so many people. What we have found in this poor economy is that our numbers have tripled in the last 5 years, or really 4 years, and we are finding more and more middle class.
I'm the founder of Project Cuddle, and as we're talking about numbers, I guess this is a monumental one for me because I just turned 58, and my vision, my dream started 50 years ago. I had the 2 children that I always dreamed I would have, and then I started fostering thinking I'd get the abandoned babies, and I didn't. I got the drug-exposed babies. So after caring for 35 of them and adopting 5, there was no more room at the house.
I was homeless for 9 years, and when I was out on the street, I was hungry. I slept under the trees in the wash. And today, I've been at my job 9 years, and I run a ministry that is right at my heart, helping not just homeless, but low-income people have food on their table. It's tough out there. A lot of us, it's one paycheck away.
Young and Healthy, so appreciative of PFAR and the funds that you're able to give us. We are a nonprofit organization in our 24th year, and we provide free medical, dental, and mental health services to uninsured and underinsured children and former foster youth in the Pasadena area.
I just want to educate you a little bit about Alzheimer's. The people I serve are from the age of 61 to 99. They have mild to severe cognitive deficiencies. Alzheimer's is the 6th leading cause of death in the United States. Out of the top 10 leading causes of death in the United States, there is no prevention for Alzheimer's, there's no cure for Alzheimer's, and there's no way to slow the progression of the disease.
Through our ongoing supported funders, we are really fortunate to be able to serve not only the kids that we see now, but all of those that are coming through in the future as well. And so from Eli and from all of us, thank you so much for all of your support over the years.
Yay.